Maggie. I'm your nurse today. How are you?
I'm good. How are you?
I'm good. I'm here because I'm going to do a musculoskeletal assessment. So I'm going to be checking your spine, your muscles, to make sure there's alignment, to make sure that there are no abnormal findings, okay?
Okay.
All right. So first off, I just did hand hygiene with the hand sanitizer. I want to make sure that I have my hands clean before I come into the patient's room. And if there is no hand sanitizer in the room, I would use the sink, soap and water. And then I'm going to put on some gloves for infection control purposes to keep you safe. So I'll have you stand up, and we're going to be doing some bending exercises, some strength exercises to make sure everything's good, okay, that you have good strength. I know you came into the hospital because you were having some weakness in your hand grip, and that could be related to the stroke that you had a few months ago. So we're going to evaluate that to see if there was any deterioration or improvements. Okay. All right. First off, let me verify your name and date of birth.
My name is Dorothy Bloom, and I was born May 25, 1981.
Okay. And can you please verify your allergies?
No drug allergies.
Okay. So I have verified that I have the correct patient by checking the name, last name and first name, and the date of birth, which matches the bracelet. Sometimes if you have a patient with the same name or similar sounding name, you want to make sure that you verify the medical record number as well. And the allergies they check out, okay? So Ms. Bloom, I am just going to set up my workstation here. I'm cleaning it with my disinfectant wipes, okay? Cleaning this table, make sure that's clean. And then I'm gonna bring up your bed just a little bit to make you a little bit more comfortable. So I'm going to use the controls on the side of the bed so that way I can bring the head of the bed up. Let me know when that is okay.
Yes.
All right.
Thank you.
Okay. So to start off, Miss Bloom, we're going to, and I've provided privacy by closing the door, but if my patient had curtains in her room, I would close the curtains to further provide privacy. I want to make sure that the patient's bed is at a good height and that the patient stays protected. So both side rails are up on the top. And if needed, if my patient was at risk for falls, I would make sure that one of the bottom side rails is up as well. So whenever we do our assessment, Ms. Bloom, we start off with inspection. So first off, I'm inspecting to make sure that everything is aligned, the skeletal structure of your body is aligned, that it looks symmetrical, the shoulders, they look aligned, the length of your arms, they look about the same length, okay? And when I get you to stand up, I'm also going to check the back of your spine, okay? So oftentimes when you're doing an assessment, it's best to do everything that you can with the patient laying down, especially if they have mobility problems. So if your patient has weakness, they're immobile for whatever reason, you will have to accommodate your assessment or alter what you're doing so that way you can do it while they're in the bed. You won't be able to have them stand up and do all the bending and such. So for this first exercise, I'm going to have you just look at me. Here, let me move this over. And I'm going to have you sit on the edge of the bed, if that's all right. Okay. And actually, let me just put this down a little bit more. pillow falls down. Okay, and I'm going to put the side rail down just so it's not in the way. And then I think that would do it. Okay, so as I'm inspecting, I'm going to inspect, make sure everything looks aligned, the contour of your bones, the contour of your muscles, to see if there are any like any masses or anything that would stick out of your, your normal muscles, muscle shape, contour. They look symmetrical. I'm also going to inspect the back while I have you sitting up. So I'm going to inspect the spine. So I'm going to assess to make sure that the spine is aligned, okay? That the cervical spine is aligned as well. And you are going to feel and see the C7 spine, which is the bone that sticks out from the neck. So that should be usually prominent, so it sticks out a little bit. So as I'm assessing the back of her thoracic spine, that appears aligned, okay? The muscles, you also want to assess for size, symmetry, fasciculation. So fasciculation are like little twitches, and then spasms. So sometimes we get spasms if you have like a vitamin deficiency or electrolyte deficiency, and that's because of how our muscles work with the electrolytes like calcium. Okay, so now we're going to assess or inspect the joints. So I'm assessing these joints to check for range of motion and also inspect to see if there are any irregular shapes to the joints. So this first one that I'm looking at is the olecranon process, okay, the elbow. And when you're doing active range of motion, that's when the patient is actively moving their muscles and joints. So I would ask Miss Bloom to flex her arm. Okay, so that's active range of motion. And then passive range of motion is when I'm moving it for her. Okay, so some patients, they have no strength, therefore no active range of motion. So you will have to do passive range of motion to assess if they're able to move those joints, those articulations. Because in the event of contractures, muscular contractures from disuse of the muscles, it will prevent that joint, that muscle from contracting, and then that joint will stay stiff, okay? And also assessing if there's any clicking or popping sound, which is called crepitus. And that can occur just from the joints not having enough fluid in the socket, and it causes that popping or clicking noise. A condition that can cause that is also like arthritis, okay? So I would also be assessing the joints here in the shoulder. So this is where the acromion process is. So as I'm doing passive range of motion on my patient's arm, I am assessing for any popping or clicking sound. And I always want to repeat on the other side, okay? So there is no crepitus on either side, okay? And I would do that on the neck as well, and on the TMJ, which is a temporomandibular joint. I would have my patient open and close, open and close. And then Miss Bloom, if you can move your jaw side to side, okay? Okay. So at that point, I'm also assessing for any crepitus in the joint. And then I would also be assessing in the other joints. I would be assessing on the knees. So when you're assessing the knees, you would be assessing the patella, okay? And I would have my patient flex, so try to lift your leg, okay? And I'm having her do active range of motion, and then I would do passive range of motion as well. So I would be using both hands while doing this to assess for any crepitus, any, oh, I felt a little bit there on the right knee. And I would document those findings as well, okay? So very good. And my patient has active range of motion, full active range of motion, which is what we expect to find. Now, some patients will have limited range of motion due to weakness, due to their medical condition. So if that's the case, you will note that as such. Another thing that you want to assess when you're assessing the muscles and the joints is you want to palpate. When you're palpating, you're going to palpate that joint for any heat, swelling, tenderness, okay, which could be from arthritis. We also want to assess the skin and those subcutaneous tissues that are over the joints and the muscles for any discoloration. You also want to look at this number of skin folds, especially in the back, because if they have several skin folds on the bottom, like by where their lower back is, that could indicate scoliosis where their spine is misaligned. So you'll see a variation of skin folds at that point. So we're also assessing for swelling and masses, okay? So when you're palpating the muscles, you're palpating for the tone. Does the tone feel firm? Does it feel soft? Does it feel flaccid? In most cases, our tone should be soft, okay, but firm, meaning that those muscles have been used, that they've been worked. And so what flaccid means is that the muscle has not been used at all. So it's going to be very floppy, okay? So that's the other thing that you want to assess when you're doing the musculoskeletal is assessing that muscle tone. So Miss Bloom's muscle tone is soft but firm. It's not hard, which could indicate a mass or swelling, possibly from injury or a medical condition. All right. The other thing that we would want to assess for is the making sure that the muscles are bilateral. We always want to make sure that everything is even. So in some cases, when you have a patient that may have had a stroke, or if they have immobility on one side of their body, you will notice that the weak side, their muscle tone is always going to be weaker or more flaccid, okay? And they're going to be using it less, of course. So that usually will indicate, okay, we need to do more physical therapy on that arm. So that way we can get it hopefully back to its pre-diseased state. Whenever you're doing your inspection, you can also opt to not wear gloves when you're doing this, but make sure that you obey all infection control rules, because anytime you're touching a patient, you know, that's potential exposure to, you know, microorganisms. Unless your patient has contact precautions of any kind, then you definitely need to wear gloves. But since you're going to be doing a lot of touching, you want to feel for any heat, which are signs of inflammation. You can opt to not wear gloves, but just make sure that you wash your hands or use hand sanitizer right after to keep in with infection control guidelines. For purposes of the checkoff, you will have the option of doing your assessment with gloves or without gloves on certain parts, or you will verbalize that you would do it without gloves. So that way you can get a better feel for the temperature of the structures that you're testing. And like I said earlier, you're going to always assess both sides to make sure they're equal. And if they are not equal, then why? And you want to document the assessment findings that, it was not equal. You can always use the back of your hand, the dorsum, to assess for skin temperature, because oftentimes the palm of your hand will usually be warmer. So the back of your hand, the dorsum, will give us a better depiction of what the patient's actual skin temperature is. So my patient's skin temperature is warm to the touch, but not too warm. So it's adequate, it's appropriate. There are no abnormalities. In the event that the patient has swelling in the joints, sometimes too, like their fingers will be irregularly shaped. That's usually due to a condition called arthritis. And there are two kinds. There's osteoarthritis, which is usually age-related, and then the rheumatoid arthritis, which is the immune system. Okay, it's fighting against it. So it's an autoimmune disorder. So usually what you'll see with the type of arthritis is with rheumatoid arthritis, usually the swelling in the joints will occur on both sides. It'll be bilaterally. They experience pain, edema, which is inflammation, warmth in the joints. And then osteoarthritis, which is the age-related, they usually have the pain, the really enlarged joints with pain on movement, but it usually occurs only on one side, not on both sides, like it does with the rheumatoid arthritis. Okay. So for this next part, Miss Bloom, I'm going to have you stand up for me. Okay. And I'll have my patient put on her slippers for safety. Okay. So I'm going to do an inspection of the overall body posture of my patient. So I'm going to have her put her hands to her side and stand up as straight as possible. Okay. So I want to see how well her back is curved, and then I'm going to have her turn to the side so I can get a better view of her total skeletal structure. Okay. As she's standing up, I want to make sure that the curvature of her spine is appropriate. So typically this is where you can find if the patient has an abnormal curvature of the spine, which could indicate scoliosis, which could indicate kyphosis or lordosis. So those will be in your book, but scoliosis is when the spine is S-shaped. So usually when your patient has that scoliosis, they're gonna look off. So their body's gonna be crooked. Okay. Usually it'll be one side or the other. It'll be kind of off. You can also tell by looking at the length of their legs. It will be one leg will look like it's longer than the other or shorter than the other. So that would be the scoliosis. Typically, that's a condition that can be caught early on in the school age years, like around 12 years old. And they do the screenings for scoliosis at the school because it usually will be more obvious during once the kids hit puberty. The kyphosis will usually be when, kind of like the hunchback, so that'll be when the upper thoracic spine is sticking out. So this patient will look like they're a hunchback, okay? Their back will be hunched. So here, let's turn it over, okay? They'll be hunched over like this. Sometimes you'll see this in patients with osteoporosis. As they age, their back just kind of curves around like that, and they look like they're hunchback. And then the last abnormally shaped spine is going to be the lordosis. So lordosis is when their lumbar spine is usually overextended. So it makes them look like their bottom is sticking out like that too much. So that's called lordosis. So at this point, from what I can tell, my patient has normal spinal alignment within the expected findings. There is no abnormal curvature to the spine. Okay. I'm also going to assess at this time. So my patient has some pants but on her. So we can assess her iliac spine. So you want to assess the iliac spine to make sure it's equal bilateral, because again, if the patient has scoliosis, the iliac spines are going to be unequal. They're going to be unbalanced. Okay. So we want to make sure that the iliac spine, which is where the hip, kind of where you feel your hip, you want to make sure that those are aligned and that they're equal on both sides. Okay. You want to make sure that you also want, when you have your patient standing up, you can have them lean forward. Okay. And that way you can, so Miss Bloom, let me have you lean forward. And I want to assess to make sure that her spine is truly aligned, that there are no irregularities that I may have missed when I assessed her earlier. And it does indeed appear that her spine is aligned. So that's good. That's what we expect to find. Because when your spine is not aligned, you will have back problems and lots of pain. And sometimes people will get surgery and it's never the same. At this time, while I have my patient standing up, I also am going to have her walk. I want you to walk forward 4 steps, Miss Bloom, and then I want you to turn around and then walk backwards.
4 steps also.
Yes, 4 steps. Okay. So you can start now. I want to assess to make sure my patient's gait is steady. I want to make sure that she is not unsteady or unbalanced, because this might be a problem, obviously, for fall precautions. We don't want our patient to fall. So you want to be standing close to your patient. In the event that they have an unsteady gait, then you can catch them if they fall. So let me have you walk again, 4 steps to the front and then 4 steps to the back. There you go. So my patient is steady and has a steady gait, okay, which is what we expect. All right. She also has good coordination to her movements. Okay. All right, Miss Bloom, let me have you sit back on your bed there. So this next step, I'm going to check the temporomandibular joint. This one is just going to check for the range of motion. So earlier I checked the joint to check for the crepitus, that clicking or popping, okay? But this time I'm also going to be checking for the range of motion and the strength. So when we're checking the strength, that's the temporalis muscle that is controlling it. So we're also going to be engaging those muscles so we can assess for any irregularity in the contour of the muscle, okay? So I'm going to locate your temporomandibular joint, okay? And I'm going to palpate it, and I want you to open your jaw for me, okay? And that usually will help to make sure that you locate it correctly, okay? So it should be right in front of the ear. Now, some people have, you can close it now. Some people have a condition called TMJ, temporomandibular joint, or TMJD, temporomandibular joint disorder. And that's when that joint dislocates, either because it wears out. And so they have a lot of clicking and popping. And often when they chew hard food, it dislocates and then it hurts. So it's very unpleasant. It can cause a lot of pain and wear and tear on those joints, okay, throughout time. So once I've done that, so I will have my patient tell me if they have any pain or discomfort when they open their jaw.
Open my jaw now.
Mm-hmm. No. Okay, close it. Open it. Close it. No. Okay, so now I want you to open your jaw and I want you to move it to the side to side. Okay, and here I'm going to move this over so the students can see. Okay, any pain or discomfort? No? Okay.
Nope.
I do feel a little bit of crepitus, but that is normal. Okay. A little bit is considered normal just because of the movement of the jaw. This third step I want you to do, and this is again checking the range of motion. I'm going to have you stick your jaw out like that, okay? And as I'm still palpating on that TMJ, okay? And then I want you to stick it back in and then stick out your jaw again. Any pain or discomfort? No? Okay. I do not feel any crepitus or hear any crepitus when you're doing that, okay? So that's good. The other thing that we're going to do is checking the strength of the muscles, okay? So when we're doing this, I'm going to have you clench, okay? Clench your teeth.
Mm-hmm.
And I am...
When you say clench, like...
Yes.
Mm-hmm.
So I'm going to palpate that temporal muscle, which is going to be by the temples. Okay, and then relax. Okay, and then bite down. Okay. So I can feel those muscles and they are engaged when she bites down or clenches her teeth, which is what we expect to find. Okay. And then I'm also going to palpate the masseter muscle. So the masseter muscle is going to be located down here by the cheeks, by the jaw. Okay. So I'm going to have my patient clench her teeth again. Okay, very good. And then relax. Okay, and then clench. Okay, and then relax. So she has some good muscle tone when she is clenching her teeth, which is what we expect to find, especially because these muscles are used for chewing, okay? Or mastication is the medical term. And when you're assessing these contractions, you should notice that they are bilaterally strong. So again, we want to make sure that both sides are the same, that they're either strong equally or weak equally. And sometimes they will have, one side will be stronger than the other, all right? So when we are testing the strength of these muscles, that is testing the fifth cranial nerve, which is called the trigeminal nerve. This one will also, it also has a sensory function, which will allow us to feel sensation on the face. So if I were to pass over a little cotton ball over her face, she would be able to tell me whether she feels it or not. That cranial nerve gives our face sensation, okay? If you notice any abnormalities, you would document it as such. But in this case, I noted that the muscle tone was appropriate and it was equal bilaterally for the temporalis muscle and the masseter muscle. All right. So now that we did this part of the body, now we're going to move down to the cervical spine. So the cervical spine is going to be the neck. Okay. So when you're assessing the cervical spine, again, you want to start off with inspection. So we're going to assess for alignment, symmetry of skin folds, and muscles. Now, some people may have problems with their cervical spine where they have a condition called stenosis. So stenosis is stiffening or hardening, and that could be from the vertebrae. They might have had a rod placed in the past. They may have had surgery. So be careful with this part or whenever you're examining any part of their spine, because if they've had surgery, they may have limited range of motion or pain when you're doing these exams, or they might not be able to perform these exercises or these tests because of that surgery. You don't want to prevent further damage or injury to the patient. When you're assessing the cervical spine, you're assessing the range of motion and the strength. So this first test that we're going to do, Miss Bloom, for your spine is we're going to be testing the forward flexion. So forward flexion is just means that you're going to tilt your head forward, okay? And then I want you to do the hyperextension, which is you're going to bend your head backwards, okay? And while my patient is doing that, I'm going to assess the back of her spine, okay? So forward, okay, and then backward. And I'm assessing to see if there's any crepitus or any abnormality that might show up when she's doing these tests, okay? So there is no abnormality with her cervical spine, which is what we expect to find, okay? The next one is going to be lateral bending. So when you're doing the lateral bending, I want you to try to touch your right ear to your right shoulder and your left ear to your left shoulder, okay? So we'll have you do one side first. So start with your right first. Okay.
Like as
far as you can.
Okay.
All right.
Mm-hmm.
Okay, that's good.
Okay.
And then now your left. Okay. Very good. And then now I want you to do the rotation. So when you're rotating, you're looking to the side. So I want you to look to the right first. Very good. And then I want you to look to the left. Okay. Any pain or discomfort?
No.
No? All right. So no tenderness, no pain or discomfort noticed. Very good. So my patient has full range of motion on the cervical spine. So now we're going to test the strength of the cervical spine. So the two muscles that help with control of the cervical spine of the neck are the trapezius muscle and the sternocleidomastoid. So the sternocleidomastoid is this muscle right here that helps to keep our head propped up pretty much, okay? And then the trapezius is the one in the back that looks like a triangle, okay? That's why it's called a trapezius. So in order to test these muscles, I'm going to have my patient turn to the left as, yes, your left, and then I'm going to push against your head, okay? All right, very good. And then now I want you to turn to your right, and I'm going to push against your head, okay? So I'm going to be assessing that strength. Whenever you do the muscular strength, we're always going to assess it on a scale of 0 to 5, okay? We have a muscle grading scale. We love to grade everything as nurses. So 0 means there's no strength at all, okay? The muscle is completely flaccid. A 5 is the strongest, okay? So that the muscle is strong and it has full range of motion. So I would classify that as a 5 out of 5. You're always going to have the patient's result out of the total 5, okay? So it's going to be 5/5. If I did notice some weakness on my patient, that could be like a 2 or a 3, okay? The grading system is going to be in your textbook. But let's say it was a 3 on the right and a 5 on the left. So I would put right, it would be 3/5. 3 out of 5, okay? And we'll talk about that more in class as well. All right, so this next exercise, I'm going to have my patient try to do some forward flexion, so move her move her head forward, and then I'm going to push against it as I'm supporting the back of her head. Okay, very good, very good. So what you should feel is that the patient's muscle strength is pushing really strongly against you, and sometimes you feel like you're going to lose your balance if you don't hold yourself up. So it's like you're engaging your muscles as well in trying to keep them upright. And then this last exercise is going to be the patient's going to try to push their head backwards, and then you push against their head. Okay, very good. All right, Miss Bloom. So all of those tests were 5 out of 5. So we would say that for the cervical spine strength, she has a 5 out of 5 bilaterally, so on both sides. because we tested the left and we tested the right. All right, so the next exercise that we're going to do, or the next test, is going to be on the thoracic and the lumbar spine. So with the thoracic, we kind of did this already when we had the patient stand up and we were checking for symmetry of the spine and the alignment. But what you can also do is have the patient at this point, if you didn't get a chance to do it earlier. So you could have your patient lean forward at this time, okay? And you could assess it from this point. Especially like if your patient is not able to get out of bed like this on the side of the bed because they might fall, you could have them try to sit up as much as possible in the bed and just lean forward as much as they can so you can assess the thoracic spine, okay? So with the thoracic and the lumbar spine, we're going to test the range of motion. Okay, so at this point, I'm going to have my patient stand up just so you can get a better visual. I'm going to move this over. All right, Miss Bloom, I'm going to have you lean forward, and this is called forward flexion. Okay, so you're just going to lean forward like you're trying to touch your toes. Okay. More. Like that. Yeah, that's good. So at this point too, you can assess the spine if you need to. But okay, so let me have you stand upright, okay, and try to touch your toes again. Okay, very good. So the patient has range of motion, active, full range of motion, and she's active with the forward flexion. And then now I'm going to have her do hyperextension. So hyperextension is going to be you're going to lean back, okay? The opposite. So at this point, we're going to, let's get here. Okay. So you want to be behind your patient so you can support them in case they fall or start to fall. So, okay, let me have you lean back as much as you can. All right, without falling. All right, very good. So she has full range of motion for the hyperextension. And then the last section is going to be lateral bending. Okay, so, or two more tests. So this one's going to be lateral bending. So you're going to turn to your side. Okay, so we want to see how well she can bend to one side.
And you try to reach to the right.
And then now try to switch off to the left. So try to reach your left side. Okay, very good. And here, let me type this up for you. So you always want to provide privacy for your patient. So if they're wearing a gown, you can put another gown over like a little shirt so that way it covers their behind. Okay, so she has good range of motion on the lateral bending. It's expected findings, and it's full active range of motion. And then the last one's going to be rotation. So with rotation, Miss Bloom, I'm going to have you go, I want you to turn to the side like this, like you're swinging your arms to the side. Okay, very good, very good. Okay, any pain or discomfort when you do that?
No.
Okay, excellent. So full range of motion when she does the rotation. In the next section, let me have you, we're going to inspect your shoulders. Since I have you standing up, we'll do this while you're standing up. Excuse me. Like I mentioned earlier, I can palpate those joints, which is the acromion process, to assess for crepitus, to assess for pain, inflammation, heat, any abnormal masses that could be in the shoulders and the muscle. So you would want to assess for that, and then symmetry. The range of motion that we're going to test with the shoulders is going to be shrugging. Okay, so let me have you shrug up and down. So you're moving your shoulders up and down. Okay, very good. Now I want you to do forward flexion. So forward flexion, you're going to move your arms forward. Okay, kind of like you're sleepwalking.
Or a zombie.
Okay, very good, a zombie. All right. And now I want you to do hyperextension. So that's going to be moving your arms backwards. Okay, very good, very good. So let me have you turn this way so that way the students can see. All right, so hyperextension and forward flexion. All right, very good. Now, Miss Bloom, I'm going to have you do abduction and adduction. So abduction, you're taking away. So I'm going to have you raise your arm up. Okay.
One arm.
So we'll start with the left. Very good. Okay, so that's abduction, and adduction is bringing it back to the side. Okay, very good. Now I want you to do your right. So abduction is moving it up, and then adduction is putting it back. Very good. And then the next one is going to be external rotation and internal rotation. So this is external rotation of the shoulders. So whenever you're doing the external rotation of the shoulders, you're going to have your patient, they're going to put the back of their hand to the back of their head, okay? So this is going to cause the shoulders to rotate externally or outward, okay? And then, so you can have them do this with one arm, okay? And then you will have them do internal rotation by having them put their arm on their back like so, with their palms facing out. So this will be, the palm will be facing out, but that's called internal rotation because the shoulder will rotate inwards versus outwards. So again, external rotation will be when they put the back of their hand to the back of their head, okay? The shoulder rotates outward. And then the internal rotation will be when they put their hand behind their back here and their palms are facing out. That causes the shoulder to rotate inwards, okay? Very good. So now I want you to repeat it on the left side, Miss Bloom. So external rotation, and then internal rotation will be putting it on your back. There you go. Very good. Any pain or discomfort there? No? And you can be palpating their joint when they're doing these range of motion exercises, so that way you can assess if there's any crepitus, any pain, tenderness, anything like that. Okay. The next thing that we're going to test with the shoulder strength is the shoulder strength. So whenever you're doing the assessment of the strength, you're assessing the muscle strength, right? So we're going to test the trapezius and the sternocleidomastoid. And mainly it's going to be the trapezius. It controls the shoulder movement. And this is going to be the spinal accessory cranial nerve, or cranial nerve 11, which is the spinal accessory nerve. So it helps to control the shrugging, all right? So in order to test the muscular strength of this muscle, you will ask your patient to shrug, okay? And you're going to be pushing down against them, okay? So let me have you relax and then shrug, okay? So you're going to be pushing down against them, and you should expect to find strong resistance. So that would be classified as a 5 out of 5 bilaterally, so on both sides. Okay, good job, Miss Bloom. You have good, strong trapezius muscles. Other tests that we're going to do for the strength is we have circumduction. So circumduction is going to be, I'm going to have you rotate your arms this way. Okay? Yes.
To the side?
To the side.
Okay.
So you're going backwards and then you're going forwards. So you're going to move it forwards. Okay? So this is also testing range of motion as well as the muscle strength. Okay? You're also going to do medial rotation, which is putting your arms forward like so, okay? And then moving it to the side, okay, like so. Okay, very good. That helps your shoulders are the ones, if you practice, you can feel those shoulders activating, okay, and working to rotate the arms out that way. Very good. Another way that you can test for strength is you can have your patient try to raise their arms like so, and then you can push down against them, especially if they are bed bound. And if they're able to, as they're sitting, if they can lift their arms up, you can test the shoulder strength that way as well. Okay. And then you would have them try to lift the arms up, and then you're pushing against. Okay. So they're pushing their arms down and you're pushing against them upwards, and then vice versa. Okay, so those are some other ways you can test. Your PowerPoint's also going to have some more examples that you can use to test shoulder strength. This next test is going to be the elbows. So the elbows, so we reviewed the Olcrenum process, that's the joint, okay? So that's the joint that's used for the elbows. So we're going to look for the range of motion and the muscle strength of the elbows. So when you're assessing the elbows, you're assessing to making sure that the contour of the structures. So you're going to have your epicondyle, which is this little bone that sticks out, okay? You're going to palpate the ulna, the Olcrenum process, the medial and the lateral epicondyles of the humerus. So those are actually, I'm sorry, I said this is the epicondyle, but the epicondyles are going to be the ones on the side that are part of the humerus. So this will be the Olcrenum process, okay, the one that sticks out. If you hit it, it hurts. So we're going to test the range of motion. So to test the range of motion, we're going to have the patient flex. So in order to flex, the patient will have to bring, I'm going to lift her sleeve so we can see, but I'm going to have the patient, without moving the upper arm, I want her to move that lower part of the arm up, okay? So flexing like this, kind of like you're lifting weights, like you're doing your dumbbells, okay? Your bicep curls. You're not moving that upper arm. So that's engaging the elbow and those muscles. So that's forward flexion, okay? And then extension will be putting your arms straight, okay? So that's when my patient puts the arms straight. So that's extension. And it should be like 180 degrees, so a straight line. All right. So another test that we're going to do to test for the elbow range of motion is going to be pronation and supination. So pronation is whenever the palms of the hand are downward, facing downward. So this will engage those muscles that control the elbow. Okay. So I'm going to have my patient, so she's doing pronation, and supination is when the palm is facing up, okay? So that's supination, and then pronation is when they're facing down, okay? Very good. So I want you to keep this straight without moving the upper arm, okay? And then let me have you put the palms up, okay? And then palms down. Palms up, palms down. Okay, very good. So active range of motion, full range of motion on the elbow for the supination and pronation. All right, very good. You're doing really good, Miss Bloom. Very well. So the next section is going to be hands and wrists, okay? With the hands and wrists, this is where it becomes a little bit more detailed. We're assessing the structures of the hand and the wrist. You want to assess the bone structure, the, what do you call it here? The metacarpophalangeal flexion, the joint surfaces, the contour, the dorsum and the palm of the hand. Again, if your patient has arthritis of the osteo kind or rheumatoid kind, then you will notice the irregularities in the joints. They'll be really large, and sometimes it can deform the patient's hand. So we're assessing the palm of the hand or the hands for contour, position, shape, the number of digits. You may have patients that are missing fingers, missing digits because of amputation, due to diabetes, or due to poor circulation, maybe from hypertension, maybe from diabetes, maybe from trauma. So anyway, so you want to assess how many fingers they actually have, and what they look like, what those joint surfaces look like. I like to palpate every joint to make sure that there's no inflammation, no warmth. Okay, so these are going to be the metacarpophalangeal, okay, joints, and then these are going to be the um, yeah, these are actually the metacarpophalangeal joints, the smaller ones, and then these are the carpal. So once we've done that and we've assessed that the joint surfaces feel smooth and there's no inflammation, no pain, no heat, then we can start doing the range of motion and the muscle strength. So for the range of motion of the hands and the wrists, we're going to do the metacarpophalangeal flexion and extension. So with that one, you're going to have, or let's start off with the wrist, okay? So you're always going to start off with the parts closest to the body, the center of the body, and then work our way out. So distal, which is far away, and then proximal, which is closest to the body. So for the wrist part, I'm going to have my patient flex. So I want her to flex her wrist up and down. Okay, very good. Any pain or discomfort, Miss Bloom? No? Okay. How about your left? Okay. And sometimes if they have their bracelets too close to the wrist, that can hurt them. So try to move it back. All right. Any pain or discomfort there?
None.
Okay. Excellent. All right. So now I want you to, so flexion is going to be going downward, bending. So flexion means bending. And then hyperextension is going to be, bringing it back up. So that was flexion and then hyperextension. And then for the metacarpal phalangeal flexion, that is actually at this point. It's just simply flexing without moving the whole wrist. So you're keeping the wrist stable, and then you're going to be flexing those joints and then extending. Hyperextension, flexion. Extension, flexion. Okay, very good. Because those are joints in of themselves as well that we need to test. So extension would be this way. Hyperextension would be bringing it back. So it's like against the normal range, which is the 90 degrees. Then we're going to do the wrist radial and ulnar deviation. So at this point, you're going to put your hands out like so, and then I want you to try to move your wrist without moving your arm and tilt it to the side. So you're going to be rotating it to the side. Okay, very good. Any pain or discomfort, tenderness? No? Okay. And I don't feel any crepitus as well when she's doing that. Okay, very good. So that was the radial and ulnar deviation. The next one is going to be the finger abduction. So with the finger abduction, you're basically going to be stretching the fingers out like so, okay? And then abduction is you're bringing them back, okay? Abduction, adduction, okay? So very good range of motion there, very good. If your patient had any neurological trauma or damage, they would have problems doing that because of the nerves that are affecting from the stroke or the brain damage will affect the muscles and therefore movement when they're trying to do that. It may or may not. It just depends on how severe the trauma was. And then we have the finger flexion. So with this one, I'm going to have you form a fist with both hands, okay? So that's finger flexion. So good range of motion there. It's appropriate. And then this last one is going to be finger extension, thumb. So you're going to move your thumb to each finger, okay? And then I want you to do it to your fingertip, your pinky finger, I'm sorry. So like this, or you're moving your thumb to your pinky. Okay, very good. Any pain or discomfort there? No? So to test the strength of the hand, I am going to have my patient squeeze. You always want to give them 2 fingers. If you give them your whole hand, they're going to squeeze your hand, and it hurts. So they're going to crush your bones, your fingers. I'm going to have my patient squeeze 2 of my fingers with her hand as hard as she can, okay? And I'm going to assess her strength, her grip strength. Okay, thank you, very good. So she has strong strength, which is 5 out of 5 bilaterally on both left and right hands, okay? So very good, Miss Bloom. It appears that from your baseline, you were having some weakness on your upper body, and your strength, it appears, has returned. So now you are at our what's expected, the expected findings. Okay?
Good news.
That is good news. All right, Miss Bloom, let me have you sit for now. Thank you. Thank you so much. You did a great job with those exams. So, so that's the upper body. With this next section, we're going to do the lower body. So when we do the lower body, we are going to start at the hips, okay? So with the hips, I'm going to have my patient, let's see, I'm going to move this over to the side. So I'm going to have my patient lay down. No, I'm going to pull this blanket away so that way we can see. Okay. So for this first test, let's see. I'm going to have my patient do a few exercises to assess the hip. Okay. So again, when you're assessing the hips, you're assessing it for symmetry. They should be the same height bilaterally. We're going to be assessing the range of motion as well as the strength. Okay. So our hips, we use our hips to do a lot of movement, right? So let me see. It'll be put this side rail down and put the other one up so my patient doesn't fall out of bed. Okay. So Miss Bloom, I'm going to have you lay down for me. Okay. I'm going to put your bed down a little bit more. Okay. Is that too flat for you? No? Okay. So with this next exercise, I'm going to have you do what's called hip flexion. So with this one, I'm going to have you lift and bend your knee at the hip. Okay? So I'm just going to do some passive. Oh, there you go. There you go. So I'm going to lift your gown up a little bit here. You're wearing pants. Yeah. So that way we can see how well you have your range of motion at the hip. Okay, very good. So patient has full range of motion at the hip. So you should feel that muscle engaging when the patient is lifting that leg or to do the hip flexion. Okay. The next one is going to be the hip flexion with the leg extended. So with this one, I want you to raise your leg, keeping it straight. Very good, as much as possible. Okay, now I want you to do the other one. Very good. All right. You have very good full range of motion of your hip with extension and flexion. This next one that I'm going to have you do is called external rotation of the hip. So with this one, I'm going to have you try to it's going to look like you're trying to create a figure 4 with your legs. Okay, so you're going to bring your foot to your knee like so. Bring it up a little bit more. Okay, and so you
touch the bed.
no, because that's what the external rotation is. So the hip is going to rotate externally this way in the socket, so the patient can place their foot on their knee like so. Okay, very good. Now can I have you repeat with the other side? Okay, very good. So we should be able to see how that hip is rotating. Very good. Thank you so much. You can put it back. This next test is going to be internal rotation. So with this one, yes, that'll be the opposite. So we will have that hip in the socket. It's going to turn inwards. So very similar. So you're going to raise your leg up like so, okay? And then you're going to turn it inwards to the opposite side, okay? So that hip joint is going to go inwards, okay? So now let me have you repeat with the other side. Okay, and it's turning. Try to keep your bottom on the bed there. Okay, all right, very good. Any pain or discomfort with that exam? All right. With this next one, it's called abduction and adduction. So basically what I'm going to have you do is you're going to, let's start off with the left one. You're going to abduct or take away. So I want you to move it to the left. Okay, very good. And now bring it to the center, and now do the same with your right. All right? Like she's trying to get out of bed. Any pain or discomfort there? Okay, excellent. So this last test that we're going to do is going to be the hyperextension of the hip with the leg extended. So if you don't mind, Miss Bloom, I'm going to have you turn onto your stomach. Okay. And with this test, I'm going to have you try to lift your leg upward, kind of like a, what do you call them, a Spider-Man push-up. What? So the whole leg. So it'll be the whole leg from the hip. Okay. Okay. Very good. And the other one. Okay. Very good. Okay. So repeat it for me again. Okay. Excellent. Any pain or discomfort with that test? Okay. Perfect. You did a great job. Full range of motion. So that would be more for the knees. So yeah. So you can turn over. Thank you. Again, keep in mind your patient's mobility status when you're having them do these exams because they're not going to be able to be up and down as you're doing the exams. We will for these purposes, but just keep in mind on your patient's mobility and then if they're having any pain or discomfort. Okay, with this last section, Ms. Bloom, we're going to do the legs and the knees. So I'm going to have you sit on the side of the bed. I'm going to raise the bed. Because I want to be able to do this test and not be hurting my back. Body mechanics are very important when you're doing your assessment because you want to make sure that you're keeping your patient safe as well as yourself. Okay. So at this point, we are going to be doing the assessment on the knees. So again, when you're assessing your patient's knees, you're assessing for swelling, pain, edema, anything like that. The crepitus, tenderness, all of that. So we're going to be assessing that popliteal space and the patellar space. All right. So we're going to assess that. Okay, so we have assessed the patellar and the popliteal space. Okay. Now we're going to assess the range of motion and the strength of the knee. Okay, and the legs and the knees. So for the range of motion, we're going to do flexion. So flexion is going to be the patient needs to bend the leg, okay? So this is going to be extension and flexion, okay? If your patient is standing up, you can have them do these exercises when they're standing up, but I want to show you how it would look like if the patient were sitting down because they can't stand up. So extension would be they're straightening it out, and then flexion would be they're bending it downward. I'm going to show you what it would look like if your patient were standing up. So you would have flexion, extension, flexion, extension, and then you have hyperextension. So hyperextension is when it extends past the point or the degree. Yeah, so that would be the flexion and extension and hyperextension. To test the strength of the muscle here, we would have your patient flex the knee and then extend, okay? So with flexion, or let's do extension, Miss Bloom. So when the patient is trying to extend their leg, their lower leg like this, you would push against it, but make sure, if you can see, I am supporting the upper leg, like the thigh, because I don't want my patient to get hurt, okay? So she's going to try to extend her leg, so moving her leg up, and I'm pushing down, okay? Very good strength. And then the next test is going to be flexion, so that's when she's trying to bring it backwards, and I'm going to be pushing against, okay? Very good strength. So 5 out of 5 on the right knee. And then I would repeat on this side. So as she's extending, I'm pushing down again, but I'm still supporting the upper leg. And then as she's flexing or trying to bring the leg backwards, I'm pushing against it. Okay. Good job, Miss Bloom. So 5 out of 5 bilaterally on both knees. And then the last section is going to be the feet and ankles. Oh, additionally, if your patient is bedbound, you can have them do these exercises and test the strength that way. So when they're laying in bed, you would have them, flex their knee. You might have to do some passive range of motion there, and then have them try to push against you or resist in order to test that accurately. For this section, we're going to be doing the feet and the ankles, okay? So just like with all the other assessments, we're inspecting first, you're assessing the joints, you're assessing the metatarsals, okay? The tibia, assessing the contour, assessing the weight-bearing, non-weight-bearing, all of that. The number of toes, the joints, all the joints in the toes and the metatarsals, and then the Achilles tendon. So the Achilles tendon is the one back here. Okay, so you're assessing that. Some people have had injuries to the Achilles tendon, so you want to keep that in mind. And then we are going to test the muscles and the range of motion. Okay. So with this first test, Miss Bloom, for the range of motion, I'm going to have you do some dorsiflexion and plantar flexion. So with the dorsiflexion, you are going to be lifting your feet up, just your feet, okay, like so, okay. And then plantar flexion is going to be like you're stepping on the gas pedal, okay. So that's plantar flexion, and then dorsiflexion is you're bringing your feet up to the ceiling. So plantar flexion, dorsiflexion. Any pain or discomfort there? None? Very good. How about your left? So to the ground, to the sky. Point to your feet to the ground, to the sky. All right, very good. Very good range of motion. So that was dorsiflexion and plantar flexion. The next test that we're going to do is going to be the inversion and eversion. So inversion is going to be where you're going to move your feet to the, kind of like you rotated your wrists. So inversion is you're going to rotate your feet inwards, and then eversion is you're going to rotate it outwards without moving this.
Okay, so just
so inward, and then outward. Very good. All right, good range of motion there. The next test that we're going to have you do is the flexion and extension of the toe. So pretty much is you're curling your toes. So you're extending. So you're going to do this with your toes. Okay. Do you mind if I take your socks off so we can see?
Do my pedicure. So
is that okay?
Sure.
If I take your socks off? All right. So you always want to ask your patient before you just take their socks off. You have beautiful feet, Miss Blue. So extension and flexion. So flexion is they're going to curl their toes, and then extension is they're going to fan them out. Okay, very good. All right.
Thank you.
You're welcome. We will do the same with the left. All right, so flexion, and then flexion is downward, extension, and then extension is upward. Very good. Good range of motion. All right. Since I touched your feet, I can change my gloves out, do hand hygiene, put on a new pair of gloves. All right. Any questions, Miss Bloom?
No.
Do you have any questions with that?
I'm glad I'm rating 5 out of 5.
Yes, you have good strength, and that's what we expect to find normally, especially because you do have, you're pretty young. The concern that we had was the fact that you had the stroke a few months ago, so that's what we were concerned about. The other thing that we can test for your range of motion is adduction and abduction. So that'll be mainly with your feet, you're moving it. So
forward.
So abduction would be you're taking it away, so you would try to move it that way.
Okay, so without moving the knees.
Without moving the knees. Okay. There you go. And then
other side.
So it looks a lot like the inversion and the eversion. And it helps more if we had your foot on the ground. Okay. And then the last step that we're going to do for this part is going to be testing the strength. So with your feet, I'm going to have you do the dorsiflexion and the plantar flexion. So where you're pointing your feet upward and then downward to the ground. And I'm going to push against, okay? So
are we going
I want you to move, try to point your toes upward, and then I'm pushing down, okay? And then now, like you're stepping on the gas, and then I'm pushing up. Okay, very good. So good strength, 5 out of 5 bilaterally. Again, in the event that a patient has had a stroke or you have any concerns about their strength, doing the grip strength on their hands and doing the strength test on the feet usually are 2 of the tests that you will want to do on the exam when you're doing a neuro/musculoskeletal exam. Okay. And then now, Miss Bloom, I'm going to have you lay on your back. I'm going to put you back in the bed. Make sure that you are in a safe position. I don't want you to fall. And at this point too, or before, you can ask your patient some of the health history questions, like if they've had surgeries to any of these structures, like maybe ACL surgery, shoulder rotator cuff surgery, cervical spine surgery, because that can tell you a lot about what they're going to be able to do or not be able to do. And it would be wise to assess these things first, so that way you don't ask them to do a test and then cause more injury to them as well. Okay. One of the other things that you can do at this time is you can test for reflexes. So with the reflexes, that's going to be part of the cranial nerve, part of the neuro. We can integrate it here. And I will have my patient sit up so we can do those exams. Or if the patient is tired, sometimes when you've done your focused assessment, they are tired, and so you'll just have to come back another time. Let's give them some rest and take a break. Okay, so we will pause for now, and we will start back up with the deep tendon reflexes. All right, so for this next part, we're going to do the deep tendon reflexes, or DTR. Whenever we do the deep tendon reflexes, we are also going to use a grading system. So with the deep tendon reflexes, we utilize this tool, this scale. So we grade it on a scale of 0 to 4. 0 is no response or no reflexes. 1 plus is diminished or low normal reflexes. The 2 plus would be average. That's what we expect to find. The 3 plus is the reflexes are brisker or more brisk than normal, but it could, if anything, could be considered a little bit normal. And the 4 is it's very brisk, hyperreactive. Usually with the 4s, that could indicate a abnormal electrolyte levels like magnesium or calcium, which control the muscular contractions. So we will assess our patient's reflexes to see how active they are, okay? So we always are going to start at the top. So we are going to start off with the biceps. So the biceps reflex, the cranial nerves that innervate the biceps are going to be C5 and C6, okay? So make sure you know that when you do your head to toe skills test. So to test the biceps, I'm going to roll my patient's gown up so you can see. You are going to place your thumb on the patient's elbow, or the inner aspect of their elbow here, okay, the antecubital space. Whenever you do this, you can have your patient flex their arm like so. So that way, just gently, that way you can palpate that tendon, okay? So I can feel it with my thumb, okay? And I'm going to keep my thumb on that area so that way it kind of helps to activate it a little bit more, okay? So I'm going to use the pointy part of my reflex hammer, but you can use the dull side as well. The pointy part usually helps a little bit more, okay? So when I am testing the reflexes, I am going to tap the fingernail of my thumb that's on that tendon, okay? Because I don't want to hit that tendon directly, especially since they're deep tendon. It's deep tendon reflexes, so those tendons are really deep. So by putting your thumb on it, it kind of helps to activate it a little better. Otherwise, you're not going to get much of a result. So when I tap it gently, I'm going to see what my patient's response is. So the response is flexion, okay? So I should expect to find that my patient's arm will flex, okay? It'll go up like this, okay? So that would be considered a 2 plus because it was the expected response. It was average. It wasn't an exaggerated response. A 4 plus would be like when I hit and the patient's arm just goes whew, all the way up, okay?
There's something wrong with it.
That would indicate that there is an abnormal level of magnesium or calcium, and that could be from medications, that could be from just a medical condition. Okay, so we're going to test this one. Okay, so that should be the expected finding that your patient's arm is going to flex. Okay, so that is the biceps reflex. The next one's going to be the triceps. So with the triceps, Miss Bloom, I'm going to have you turn a little bit more this side, okay? So I'm going to have my patient's arm like so, Okay, I want her to relax that arm. The triceps, the tendon that you're looking for is going to be back here. Okay, so you're going to palpate around and you want to feel that tight structure. Okay, sometimes you can feel it a little better if you extend that. Okay, and so what I'm going to do is I'm going to use my middle finger to place it here, and then I'm going to tap that tendon, and you should see that hand rise up like that. Okay, ready? 1, 2, 3. Okay,
Feel it.
you'll
It's
feel
not
the
racing.
twitch. The hand will move. I felt that. Okay, very good. Now, Miss Bloom, let me have you turn the other way so I can test this side. Okay, so on this opposite side, it might be a little harder, but we'll make it work. Okay, that way you all can see. Okay, so you will see her hand move. So that would be considered a 2+, okay? So the response was 2+ on the biceps, 2+ on the triceps, okay? The next one's going to be the brachioradialis. So the brachioradialis is going to be along the wrist here. So you can have your patient lift their thumb up like they're hitchhiking, and that will cause that tendon to raise right here, okay? Okay. And so again, I'm going to put my thumb on that area and I'm going to tap it gently, and you're going to see the fingers or the thumb will raise, okay, or rise. Sometimes their whole hand will kind of do a little flick motion, okay. So you can see Miss Bloom's hand is moving. There you go. Very good. So 2+ bilaterally on the brachioradialis. The next one's going to be, and the brachioradialis, the cranial nerves that innervated are C5 and C6. For the triceps, it's C6 and C7. The next one's going to be the patellar. So this is the knee reflex. So this is the one that everyone knows just from watching TV, cartoons. So the tendon that we're looking for is going to be right below the kneecap. And so with this one, you can do the reflex hammer, you can tap it directly. So we're going to tap it, okay? And you're going to see that knee move. So I'm going to move this just a bit so everyone can see. Ready? 1, 2, 3. All right, very good. And reflexes are automatic. You don't think about them. You don't see it. Sometimes if you're having a hard time getting a result from your patient, you can have them close their eyes, because if they're staring at you doing these tests, it's like a psychological thing. So it's best if they just close their eyes. So we'll repeat on the right so everyone can see. That's a very good one. So that would be more like a 3+, Miss Bloom. Very good. So the patellar is innervated by L2, L3, and L4. And then the last one's going to be the Achilles. So the Achilles is the one right behind here on the feet, okay? So I'm going to take your shoes off here, your slippers, okay? And so you're going to tap that tendon, okay? Here, let's stretch this out a little. There you go, okay? And so you should expect to see that foot do like a plantar flexion. Okay. Sometimes it'll be going upward. Okay.
No, it's
going down. So the plantar flexion. Okay, very good. So that would be like a 2+ or a 1+, because there was a little bit of movement. So that would be like the low normal. Okay, ready? Now, Also be careful, everyone, because if you're like right in front of the patient when you're doing the knee or the foot, they can kick you, especially if they have those exaggerated responses. Okay, so I saw the feet moving in the dorsiflexion. Okay, okay, very good. All right, so 2 plus bilaterally for the Achilles tendon. All right, very good. So we will continue with the rest of the reflexes when we cover the neuro system. For this time, we will wrap up with the musculoskeletal. So before we leave our patient, we would remove our gloves. We would thank our patient for their time and for allowing us to examine them. We would make sure that we would do hand hygiene after removing our gloves, and then put our patient back in bed so that way the patient is safe. And I'm going to bring this side rail back up, put the head of the bed up, unless contraindicated. You always want to promote good oxygenation of your patient, okay? And you can ask your patient, what height you want. Is that good, Mrs. Bloom? Okay. And then make sure that you put the bed all the way down in lowest position, side rails up times 2 or 3, just depending. We want to make sure that the call light is within reach, because in case the patient needs to call for help, to go to the bathroom, or if they need anything, they can reach us. And they won't try to get out of bed to do so. And we will put the call light. And you always want to remind your patient, press this button to call for help if you need anything. Okay, Miss Bloom? All right. And you want to make sure that they're nice and comfortable. So do you want your covers back on?
No.
No? Okay, no problem. All right. Is there anything else I can get you before I step out?
Oh, good. Thank you.
You're
You did
very
a
welcome.
good job.
Thank you so much. I will be back soon, like about an hour, to do my hourly rounding. So that way, if you need anything at that time, you can let me know, okay?
Thank you.
All right. Thank you so much, Miss Bloom. I'll see you soon, okay? Take care.